Listen closely. If you are over the age of 60 and you still believe that your annual medical checkup is a shield protecting you from the inevitable decline of age, you are operating under a dangerous delusion that is effectively handing your biological independence over to a system designed for managed sickness, not optimal longevity. You have been conditioned to show up once a year, offer your arm for a blood draw, and wait for a gold star from a man in a white coat who has exactly 12 minutes to review a set of lagging indicators before reaching for his prescription pad. I am here to tell you that many of the standard screenings you are dutifully undergoing are not just useless, they are clinical traps. They lead to a cascade of overdiagnosis, unnecessary medication, and iatrogenic harm that will age you faster than any natural process ever could. Right now, there is a specific set of tests, the very ones your insurance company insists upon, that are triggering a diagnostic cascade that ends in a loss of mobility, a clouding of the mind, and a permanent place in the pharmaceutical customer for life funnel. Today, I am going to expose the 5 medical checkups I would never get after the age of 60 and reveal the physiological reasons why these tests are strategically stupid for the senior who intends to remain dominant and independent. By the end of this masterclass, you will understand the tragedy of lead time bias, the deception of the LDL myth, and the exact self-diagnostic protocol required to monitor your health from your own kitchen with far more precision than any hospital lab. If you value your freedom and you want to avoid being managed into a chair, you cannot afford to ignore the clinical evidence I'm about to deliver. We must start with the fundamental failure of geriatric screening, the concept of normal for your age. The medical system bases its normal ranges on the average population, but the average 60-year-old is inflamed, insulin resistant, and sarcopenic. If your lab results are normal, you are simply as sick as everyone else. I am not interested in normal, I am interested in optimal, and many standard tests actually prevent you from achieving optimality by focusing on the wrong biological markers. The first medical checkup I would never get and would never recommend for a senior who follows my protocols is the isolated DEXA bone density scan. We have spent an entire masterclass discussing the calcium lie and the rebuilding of your skeleton. The DEXA scan is a crude instrument that measures the quantity of your bone, not the quality. It works by firing X-rays through your frame to see how much mineral is there. But as we have established, a bone can be dense with old, dead, brittle mineral and still be highly likely to snap under pressure. When you are 70 and you get a DEXA scan and it shows osteopenia or osteoporosis, the immediate response from the system is to prescribe bisphosphonate drugs like alendronate. These drugs are a biological disaster. They work by poisoning your osteoclasts, the demolition crew of your bones. When you kill the demolition crew, your builders, osteoblasts, have nowhere to put new bone. The result is that your bones look denser on the scan because you are accumulating old, rotted, dead bone tissue that should have been recycled. You are effectively painting over a rotted fence. On the X-ray, the fence looks solid, but the moment a gust of wind or a minor trip hits it, the entire structure collapses. These drugs lead to atypical femur fractures, where the strongest bone in your body snaps while you are simply walking. I refuse the DEXA scan because I refuse the bisphosphonate trap. I do not care about the density of a dead structure. I care about the resilience of a living one. Instead of a DEXA, I monitor my mechanical load capacity. Can I perform a goblet squat? Can I stand on one leg for 30 seconds with my eyes closed? This functional testing tells me more about my fracture risk than an X-ray ever could. If I have the mechanical signal and the vitamin K2 director, my bone quality is secure. I do not need a scan to tell me that my quantity is lower than a 20-year-old's. Of course it is, but my quality can be superior. The second checkup I would never get is the standard annual fasting glucose and A1C test as the primary measure of my metabolic health. This is perhaps the most lethal oversight in modern primary care. Fasting glucose is a lagging indicator. Your body is so desperate to keep your blood sugar stable that it will sacrifice every other organ system to do so. Your pancreas will pump out 5 times, 10 times, 20 times more insulin than necessary just to keep that fasting glucose in the 90 milligram range. You can be in a state of hyperinsulinemia, the root cause of cancer, heart disease, and Alzheimer's, for 15 years while your fasting glucose looks perfect. Your doctor sees a 98 and tells you you're fine. Meanwhile, your brain is caramelizing and your arteries are rusting because of the hidden insulin surge. By the time your fasting glucose or your A1C actually rises, the metabolic war has already been lost. You have already destroyed 50% of your pancreatic beta cells. I do not wait for the fire to consume the house before I check the smoke detector. I never rely on fasting glucose. Instead, I demand a fasting insulin test and calculate my HOMA-IR, the homeostatic model assessment for insulin resistance. This is a simple calculation, fasting insulin x fasting glucose, divided by 405. If your HOMA-IR is above 1.5, you are metabolically bankrupt, even if your A1C is 5.4. The standard checkup misses the most important metric of senior survival, insulin sensitivity. I refuse to be lied to by a normal glucose reading while my internal terrain is on fire. I am the strategist. I look at the input, insulin, not just the output, glucose. The third medical checkup I would never get, and this is arguably the most profitable deception in the history of pharmaceutical medicine, is the routine annual total cholesterol and LDL panel. If you are over the age of 70, high cholesterol is not your enemy. It is actually a primary biomarker for longer life and superior cognitive function. Your brain is the fattiest organ in your body, consisting of nearly 60% fat, and a massive portion of that is cholesterol. It is the fundamental building block of your myelin sheath, the insulation that allows your nerve impulses to travel at lightning speed. It is also the precursor to every vital steroid hormone in your system: testosterone, estrogen, progesterone, and cortisol. Furthermore, cholesterol is the structural glue that maintains the fluidity of your cell membranes. As we discussed in our hydration and protein masterclasses, if your membranes are stiff because you have suppressed your cholesterol, the activated water and the leucine surge cannot enter the cell. When you allow a practitioner to manage your LDL down to an arbitrary target of 70 or 80 using a statin drug, you are effectively performing a chemical defatting of your own brain. You are inviting the very brain fog, word-finding difficulties, and memory lapses that the medical system then has the audacity to label as age-related cognitive decline. It is not aging, it is a side effect of your medication. The LDL is poison narrative is a clinical masterpiece designed to create a lifelong customer for a drug class that, in the senior population, provides almost zero statistical benefit for primary prevention. In clinical terms, we look at the number needed to treat, or NNT. For a healthy 70-year-old to avoid one single non-fatal cardiovascular event, hundreds of people have to take the drug for 5 years, while nearly all of them suffer the metabolic consequences: CoQ10 depletion, mitochondrial dysfunction, muscle-wasting myopathy, and a significantly increased risk of developing type 2 diabetes. This is not a health strategy. It is a bankrupt exchange of your vitality for a pharmaceutical profit margin. I do not look at LDL in isolation, because LDL is merely a transport vehicle. It is the truck carrying the fuel. Trucks only cause problems when the road is broken. If your arteries are smooth, flexible, and Teflon coated with high levels of nitric oxide and vitamin K2, the LDL particles flow right past without ever sticking to the walls. Clogging is an endothelial failure, not a cargo failure. Instead of a useless cholesterol panel that tells me nothing about the state of my vessels, I get a coronary artery calcium, or CAC, score once every 5 years. This is an actual X-ray scorecard of the calcified plaque, the arterial rust inside your pipes. If my CAC score is 0, I do not care if my LDL is 200, I have clean pipes. Why would I take a toxic drug to lower my brain fuel when there is no evidence of disease? The standard checkup is lazy medicine. They measure the trucks on the highway because it is a cheap blood test, instead of checking to see if the road is actually under construction. I refuse to be medicated for a risk factor when I have the technology to measure the actual disease. The fourth checkup I would never get is the routine PSA, prostate-specific antigen, test for men over 75, or the routine mammogram for women over 80, unless there are acute, palpable clinical symptoms. To understand this refusal, you must understand the concept of overdiagnosis and the pathology of the senior. As we age, if you look closely enough at any human body, you will find indolent cancers, small clusters of mutated cells that are part of the natural landscape of an aging organism. These hotspots grow so slowly that they would never, ever cause a clinical problem, a symptom, or a threat to your life in your natural lifespan. If you are 85 years old and you have a tiny, slow growing prostate lesion, you will die with it, not of it. But the moment you step into the screening trap and that PSA test comes back slightly elevated, the diagnostic funnel opens up and sucks you in. The elevated number leads to a fear based biopsy. The biopsy involves multiple needles being fired into a sensitive organ, which carries a high risk of infection, seeding of potentially harmless cells into the bloodstream, and significant trauma. If they find a single mutated cell, you are labeled a cancer patient. You are then pushed towards surgery or radiation. The surgery leads to permanent incontinence and impotence. The radiation destroys the surrounding healthy tissue and increases the risk of secondary malignancies. Within 6 months of a routine test, you have traded a harmless microscopic growth for a devastating life-altering clinical complication. You have lost your dignity, your sexual function, and your independence because you went looking for a problem that was never going to find you. This is the tragedy of lead time bias. The medical system claims they extended your life because they found the cancer 5 years before it became symptomatic. In reality, they didn't add a single day to your life. They simply added 5 years of anxiety, patienthood, and treatment side effects to your existing timeline. You lived those 5 years as a sick person instead of a healthy human. I am a clinical realist. I monitor my functional flow, my stool, my energy, and my inflammatory markers, like C-reactive protein, CRP. If my internal sanitation is high, if my butyrate factories are operational, and my systemic inflammation is low, I trust my immune system to perform its natural surveillance and keep those indolent mutations in check. I do not go looking for trouble in a system that is financially incentivized to find it and manage it until your bank account and your body is empty. We must also address the routine mammogram for women in their 80s. The breast tissue of an 80-year-old is significantly less dense than that of a 40-year-old, making false positives rampant. These false positives lead to lumpectomies and radiation that a fragile senior frame cannot easily recover from. The stress of the recall alone triggers a cortisol surge that suppresses the very natural killer cells required to fight actual disease. I refuse to put my body through the stress test of a screening that has no proven mortality benefit for my age group, but has a guaranteed risk of overtreatment. True authority is knowing when to stay away from the clinic. The fifth medical checkup I would never get is the routine colonoscopy after the age of 75, especially if I have had normal ones in the past. This is a cold calculation of risk versus reward. A colonoscopy is an invasive procedure that requires deep sedation and a mechanical insertion into a senior gut that is often thin and structurally fragile. The risk of microperforation, a tiny tear in the colon wall, is significantly higher in the senior population than in middle-aged adults. A perforation leads to sepsis, emergency surgery, and a rapid descent into multi-system organ failure. For an 80-year-old, the standard prep is often more dangerous than a small polyp. The liquid required to flush your bowels for 24 hours causes a massive electrolyte crash. It flushes your potassium and your magnesium, which triggers atrial fibrillation and heart spikes in vulnerable seniors. You are risking a cardiac event and a perforated gut to look for a polyp that, if you are following my resistant starch and bitter flush protocol, should not be there in the first place. Instead of an invasive scope, I use the stool report card. I use the fecal immunochemical test, FIT, which detects microscopic blood without the risk of an internal tear. I am the lead scientist of my own waste. I do not need a camera to tell me what my pencil-thin stool or my Terry stool has already revealed. I use non-invasive intelligence to decide when to escalate to invasive intervention. I do not do invasive as a routine. Routine is for people who are not paying attention. I am always paying attention. To understand why I am so militant about these refusals, we must examine the physiology of the senior stress response. Every time you enter a hospital or a clinical setting, your white coat hypertension triggers a surge of cortisol and adrenaline. This clinical stress causes your blood sugar to spike and your nitric oxide to crash. You are at your most biologically vulnerable when you are being tested. The system then captures you in this stressed, abnormal state and labels it as your baseline. This is exactly how you end up on three different medications for high blood pressure when your only real problem is a sluggish baroreceptor and a fear of doctors. I am telling you to reclaim your biological authority. You must understand that the most accurate medical data is the data collected in your natural habitat, your own home. The standard medical checkup is a relic of a paradigm that did not understand individualized biohacking. It is a coarse filter that catches the gravel but lets the gold slip through. You are the gold. You are the elite. You must use a finer filter. This leads us to the Robert Lee self-diagnostic protocol. This is the superior alternative to the annual checkup. It is a daily, weekly, and monthly audit of your vital systems performed by the only person who is truly invested in your survival, you. Step one of the audit is the orthostatic audit. Once a week, you perform the lying versus standing blood pressure test I have taught you. This tells you more about your cerebral perfusion and your actual fall risk than any doctor's office reading ever could. If your systolic drop is less than 10 points, your baroreceptors are dominant. You are winning. If the drop is significant, you do not need more pills. You need more mineralized hydration and autonomic conditioning. Step two is the metabolic audit. Once a month, you must check your morning body temperature and your waking glucose. If your temperature is 98.6 and your glucose is under 95, your mitochondrial power plants are running at full capacity. You do not need a 3-month average like an A1C to tell you that your biological fire is burning clean today. A high A1C with a low morning glucose tells me your diet is the problem. A high morning glucose with a low temperature tells me your thyroid and mitochondria are the problem. This is how a strategist thinks. We look for the root, not the average. Step three is the waist audit. Every single morning you look at your stool. You look for the sausage shape and the slow sinker. This is your real-time colonoscopy. It tells you that your butyrate levels are high and your mucosal Teflon is thick enough to prevent mutation. If the report card is good, you stay the course. If it is poor, you increase your bitters and your resistant starch immediately. You are adjusting your strategy in real time, not waiting for an annual appointment to find out you have been rotting for 12 months. Step four is the structural audit. Can you sit on the floor and get up without using your hands? This sit-rise test is the single most accurate predictor of all-cause mortality in seniors. If you can do this, your sarcopenia risk is functionally zero. Your bone density is a secondary concern because your functional strength is intact. If you cannot do it, you do not need a bone drug. You need a leucine surge and a resistance band. Step five is the vascular audit. Once a year, you skip the cholesterol panel and you pay for a coronary artery calcium score. This is visual evidence. It shows you the road, not the trucks. If the road is clear, you realize that the statin peddler has no jurisdiction over your body. You are managing your health as a CEO manages an asset. You are cutting out the middleman. You are keeping the profit, the independence for yourself. To understand the full gravity of why you must refuse these screenings, we have to examine the concept of the diagnostic cascade. This is the silent killer of the senior population. It starts with a routine test that produces a borderline result because your doctor is operating under a standard of care designed to minimize legal liability rather than optimize your biological potential. He must investigate that result. The investigation requires a more invasive test. That test has a false positive rate of nearly 20% in adults over 70. The false positive leads to a biopsy or a minor surgical intervention. The intervention introduces a hospital-acquired infection or requires a course of antibiotics that decimate your butyrate factories. To manage the inflammation from the procedure, they put you on a steroid or an anti-inflammatory drug that spikes your blood sugar and thins your skin. Within 6 months, you have moved from being a healthy senior to a complex patient. You are now on 5 different medications to manage the side effects of a procedure that was done to investigate a test you never needed. You have been captured by the system. This is why I am so militant about your refusals. You must be the lead risk officer of your own life. You must understand that every time you allow a needle or a scope to enter your body routinely, you are gambling with your functional independence. We must also discuss the role of pharmacokinetics in the aging body. Your liver and kidneys, even if they are protected by my renal protocol, do not clear synthetic chemicals at the same rate as a 30-year-old's. Every drug prescribed from the diagnostic funnel accumulates in your adipose tissue and your hepatic cells. This toxic steady state suppresses your cellular autophagy. It prevents your body from performing the nightly repair shift we discussed in the vision and brain masterclasses. You wake up feeling stiff and foggy, not because you are old, but because your mitochondria are drowning in a pharmaceutical soup. By avoiding the useless checkups, you are avoiding the accumulated toxicity. You are keeping your internal terrain clean. You are allowing your mitochondrial power plants to fire without the interference of statins or bone suppressants. This is the physiological advantage of the informed senior. You are not just avoiding medicine, you are protecting your chemistry. Let's address the insurance trap. Your insurance provider and the federal guidelines insist on these checkups because they are statistically valid for a population that is already failing. If you have 10,000 seniors who are eating seed oils, drinking plain water, and losing their muscle mass, these crude tests might save 3 or 4 of them before they collapse. But you are not the average. You are the strategist. You are activated, mineralized, and pressurized. You are an outlier, using a general population map to navigate your optimized biology is a category error. It is like using a map of the city to navigate a high-security laboratory. The coordinates don't match. For you, the risks of overtreatment and iatrogenic harm far outweigh the statistical benefit of the find. You must have the courage to tell your provider that you are opting out of the standard failure and opting into individualized excellence. There is also a profound psychological victory in these refusals. When you look a man in a white coat in the eye and say, "I refuse the LDL panel because my CAC score is 0 and I prioritize my brain's cholesterol over your guidelines," you are establishing your biological sovereignty. This shift from compliant unit to autonomous authority actually lowers your systemic cortisol. It signals your nervous system that you are in control. As we know, a sense of agency is one of the strongest predictors of longevity. People who feel like victims of fate wither. People who act as commanders of strategy flourish. By taking control of your diagnostic strategy, you are literally lengthening your telomeres and reinforcing your own will to live. You are reclaiming the agency that the system has spent decades trying to strip from you. We must also consider the abnormal markers of excellence. If you are following the renal protection protocol, the hair anchor, and the spirulina surge, your internal biomarkers will not look normal to a standard lab. Your kidneys will be too efficient. Your blood will be too nutrient dense. Your metabolic temperature will be too high. The lab will flag you as an outlier. A standard doctor will see these high or low marks and attempt to normalize you back into the standard decline. Do not let them. Do not let them standardize your excellence into mediocrity. You are not a patient to be fixed. You are a masterpiece to be maintained. You must trust your functional biofeedback, your strength, your sight, and your waist, more than you trust a standardized lab slip. I have seen the results of this medical rebellion in my own practice. I have seen 85-year-old men who were written off by their cardiologists reclaim their cognitive sharpness and their physical stamina by simply stopping the statins and the routine scopes. I have seen 70-year-old women reverse their osteoporosis not with drugs, but with K2, magnesium, and the goblet squat. They didn't get lucky, they got strategic. They realized that the medical checkup was not a service, but a sales funnel. Once you see the diagnostic cascade for what it is, you can never go back to being a passive participant in your own decay. You become the authority. You become the strategist. You become the one who decides what enters your bloodstream and what stays out. The 5 lethal checkups have been exposed. The DEXA trap, the fasting glucose deception, the LDL myth, the PSA overdiagnosis, and the colonoscopy risk are now part of your intelligence report. You have the self-diagnostic audit as your replacement. You have the morning temperature, the sit-rise test, the stool report card, and the CAC score as your high-value indicators. You are now equipped to navigate the medical minefield with the tactical ruthlessness that your survival demands. Do not let another routine appointment be the start of your decline. Do not let standard care be the end of your independence. Reclaim your biological territory, reclaim your frame, reclaim your crown. Stand tall, stand strong, and remember that your life is a reflection of your strategy, not your age. You are the commander of your own biological terrain. Act with the authority that this masterclass has provided. The path to a century of independence starts with the discipline to stay away from the clinic and stay on the trail. The masterclass is officially closed. The new life is officially open. Rebuild your filters, rebuild your frame, rebuild your life. The end.